What is a nebulizer? A nebulizer is a machine used to change liquid medication into a vapor that you can inhale through a mask or mouthpiece. Diseases like asthma, chronic obstructive lung disease (COPD), and other lung-related issues are where nebulizers come in handy. Benefits of nebulizer: relaxes the breathing muscles, prevent shortness of breath, prevent cough and chest tightness, ease in delivery of medication, easy to use, can be preventative. The correct method of nebulizing your child at home. 1. Wash your hand. 2. Connect the hose to an air compressor. 3. Fill the machine cup with your medicine. 4. Attach the hose and the mouthpiece to the medicine cup. 5. Place the mouthpiece in your child's mouth. 6. Make sure they keep their lips firmly around the mouthpiece. 7. Ask them to breathe through their mouth for 10 to 15 minutes. 8. Turn off the machine when done. 9. Wash the medicine cup and mouthpiece with water and air dry. It is imperative to consistently heed the guidance of your medical professional to facilitate the path to recovery.